the coronavirus, in fact, has hit a time when the country was contemplating the National Health Insurance Bill. The virus has tested countries with even the best recognized universal health cover. Our Finance Minister, Tito Mboweni, made no mention of the NHI and its introduction in the emergency budget speech. But the private sector continues to cover only 16% of the population, while the public sector caters for around 84% of the country. With such inequality, the public sector will continue to suffer under the weight of the burden caused by the outbreak. Would the country have been better off had this policy been adopted before the outbreak? And what is this pandemic teaching us about our future prospects? To have this discussion, I am joined by Director of the Rural Health Advocacy Campaign, Russel Rensburg. Russel, good morning. Thank you very much for joining us here on Weekend Dawn. I mean, just looking at the advent of COVID-19, perhaps, and how it could have provided a litmus test for both the approach and the design of the NHI or proposed NHI bill. I mean, is government's response to the COVID-19 to date a building block towards the NHI?
No, I wouldn't say that it's a building block. Good morning. It's not a building block to the NHI, but I think it definitely does show us that we may have been in a better position had we had the tools that are envisaged under the NHI. You know, at the moment, we essentially have 9 different responses to the virus. You know, so we have the national department who's trying to coordinate, and then each of the provinces are essentially managing their own COVID-19 responses. Under the NHI, we would have potentially had the national health insurance fund, which would consolidate all the funding, and we would be able to negotiate contracts at a national level with the private sector groups and with private GPs and all of the other facilities that are in the private sector, whereas at the moment we have to negotiate these at each provincial level.
So, Russel, I think just before we get into what those responses would have looked like under had that bill come into effect, but perhaps before this lockdown, the national lockdown, I wanted to know from you in terms of the definitions of the NHI, how it's defined, communicable diseases. I mean, would COVID-19 and the pandemic, users affected, actually been covered and treated under the NHI bill? I mean, what would that scenario have looked like?
No, absolutely it would have been covered.
Okay.
You know, I think, I don't think there's a question about that, because this is essentially a public health outbreak. And I think everybody under the NHI would have been covered, including undocumented migrants.
Okay, so ultimately, what would the responses then have looked like? I mean, if at all, how will the design of the NHI bill be affected in 2020, just given the global pandemic at large?
Look, I'm not sure how the design would change, but essentially what the NHI is a financing mechanism. So what you would all have all the country's health resources, or at least in the first phase of the NHI as it's envisaged, all the public sector health financing would be held at a national level, and then the health would be implemented at a district level. So what that would have meant under an NHI environment is, like as I said earlier, firstly we'd be able to do bulk contracts. So we wouldn't have to negotiate in the Western Cape and then negotiate in the Eastern Cape and then Gauteng and so forth and forward. We'll have one national negotiation framework or organizing framework to contract in the private sector. So we would be able to, which we don't at the moment, access the 9,000 private sector GPs who are currently not able to respond. Secondly, when you look at things like testing, we would be able to at least contract private sector labs in a way that we could use that capacity so that we don't have the current state of affairs where we have the public sector testing and the private sector testing. So in my opinion, we would have been able to respond to the hotspots better as well, because we would be funding at a district level rather than at a provincial level. So where districts, and has broken out, like the city of Cape Town or Nelson Mandela Bay, we would be able to have funded district centered plans, which will allow our response to be a lot more nimble. But all of that is in theory.
Exactly, and scenario planning, I mean, as we charted these unprecedented times. So Russel, on that note, speaking about testing, the issues of staffing, amongst many of the other resource issues, as we charter these waters, I mean, what ultimately is COVID-19 then teaching us about our current healthcare system? I mean, currently, as we speak, there is a Justice for Shoni hashtag that's obviously also making the rounds on social media. A 35-year-old man succumbing to dying, at the Tembisa Hospital, a public hospital in Gauteng, because he did not receive basic needs, causing an uproar. Many people questioning the state of readiness of that NHI bill that is proposed. I mean, what is it ultimately reflecting about the current healthcare system at large?
Well, for me, I think it's ultimately reflecting that we have two sets of citizens. We have a private sector response and we have a public sector response. And I think the access to care that you get now is really dependent on whether you have medical aid or not. For instance, if you go for a COVID test and you have medical aid, and your medical aid company says, okay, fine, you've met the risk criteria, you can get your test results in 2 days. Yeah. Whereas if you are without medical aid and you go into the public sector, you can wait as long as 10 days. So you have 10 days of a situation where, firstly, you could get quite sick and still not know your result. You won't be able to manage your positivity or social distance. You wouldn't really know what to do because it would be uncertain whether you're positive or not. So I think at the end of the day, and then comes in a worst case scenario, your access to high care or to ventilators could also be impacted, by the fact that you have medical aid or not. And I think that's just unjust. And health is really, it shouldn't be a commodity that gets traded on your ability to pay, but rather on your need. And I think as things stands at the moment, different people have different differential access to the health system.
COVID-19 has definitely exacerbated the issues plaguing systems within South Africa, at large. I also want to bring in the issue of corruption, looting, fraud that's also surfaced during this time, even prior to the COVID-19 pandemic. I mean, minimal prosecutions within the healthcare sector as well related to individuals who've obviously not adhered to rules and regulations. I mean, what are your comments on what's surfacing on that front as well?
Look, I don't know any of the individual cases, and it's really, and I think it's really just look, we have got a long way to go to fix our state. Our state is incapable on a number of different levels. And on the governance levels, one of the things that we need to do is start reforming the way our political parties function and the list processes, because I think there's no real accountability for individuals who are within the governance framework. And like they say, if the governance framework is weak, the bureaucracy will be weak. So I think we've learned some important lessons over the last 25 years. There's no silver bullets. I think many of the people that were in the system in the last 10 years are still in the system. But I think as the public, we need to start becoming a little bit harsher in the way that we hold our elected officials accountable. And then I think in the second instance, when we do more of that, we were able to have an opportunity to start really getting involved at the local level, making sure that the services that we get are of sufficient quality and are consistently available. And when they're not, we should speak out about it. But there's no easy answer for corruption, to be honest.
I'm also just wanting to bring in the issue of pharmaceutical services being rendered during COVID-19 and perhaps also their role in the value chain with regards to the proposed NHI bill. I mean, how is that factored in during these unprecedented times?
Look, I think at the moment it's really a difficult place to negotiate with pharmaceutical companies because I think all the cards sit with them. But I think if we have learned anything, when we look at our HIV transversal tenders for ART, in 2010 when we renegotiated that, when I say we as a country, we were able to, once we consolidated all the different tenders into one national tender, we were able to achieve significant savings. And I think the same thing can happen in an environment where we have a universal contracting system. We are able to understand what our essential medicines are. We can negotiate with the pharmaceutical companies from a position of strength, and I think we can achieve better pricing. But as it stands at the moment, I think globally and locally, I think a lot more can be done to coordinate the pharmaceutical supply chain so that we don't have a situation where rich countries can forward buy new drugs like Remdesivir. We heard that the United States are trying to buy up as much supply of that. And I think the same thing happened with PPE. The prices globally went up so much, and I think there was no global agreements, to my mind, to ensure that there was equitable access to those commodities. And I think this is something that the world and South Africa needs to learn, that we have to create a framework that everybody has access to the things that they need when they need them, particularly from a pharmaceutical point of view.
Russell, I mean, ultimately, what does this mean about future prospects? I mean, does the bill still work as it is, or does it need to be amended? I mean, does the bill cover the health matters that arise out of a global pandemic? What lessons can we, in fact, take from some of the international countries who've obviously had to deal with this wave, perhaps just before us?
Look, I think now, for me, the case for universal access to healthcare is now, doesn't even need to be made anymore. It's self-evident, right? And I think when we look at COVID, we mustn't look at COVID exclusively. COVID is really a virus that is telling us if we don't do things to make sure that people have access to the healthcare they need, we're actually putting them at risk. Take, for example, we've seen globally and in South Africa that the biggest contributor to COVID, to COVID severity, is things like non-communicable diseases like diabetes, which are unmanaged or unchecked. In our country, for instance, there are 4 million people living with diabetes, right? And of that 4 million people, just over 1 million have access to treatment. That's like 30%, or just above 30% of people who know they have diabetes and live and have access to treatment. And we know also that when you have uncontrolled diabetes, you could be 14 times or 13 times more at risk than someone that is currently on treatment. So the fact that 2/3 of people that need treatment are not on it is really an indictment of our healthcare system. So that we, both public and private, is that we're not doing enough to manage the total health burden. And I think things like COVID are showing us that we really need to take health a little bit more seriously, because it's not the virus on its own. And then when you add the fact that with all the focus on COVID, a lot of other routine healthcare services are now being delayed, and that in itself is putting people at risk. Things like immunizations and so forth and etc. And I think now we have a stronger case than we've ever had to ensure that everybody has access to the healthcare they need when they need it. And of sufficient quality.
Well, Russel Rensburg, that conversation definitely continues. I mean, certain public healthcare systems will definitely be overwhelmed during these unprecedented times as we reach the peak in South Africa. And it will be interesting to see how the pandemic perhaps nudges us even further in the direction and perhaps even hasten the process of that proposed NHI bill. Russel Rensburg speaking to us about the government's response to the COVID-19 pandemic. Thank you very much for joining us. It's just a building block for a centralized approach to universal health care.